Welcome to today's webinar, Committing to Healthier Food and Beverages in Hospitals, Innovative Approaches from the Field. My name is Kristen Sullivan. I'm the Director of Nutrition and Physical Activity at the American Cancer Society, and I'm going to be your moderator today. This is a third in a four-part webinar series sponsored by the American Cancer Society and the Public Health Law Center on creating healthier food and beverage environments in hospitals and healthcare settings, with a specific focus on reducing sugary drinks. Over the past several years, there's been a growing movement of hospitals and health systems in the US that have stopped selling sugary drinks or reduced their availability in favor of healthier options. Last year, the American Heart Association and the American Academy of Pediatrics, in a joint policy statement, specifically called on hospitals to, quote, serve as a model and implement policies to limit or disincentivize purchase of sugary drinks. The American Cancer Society and Public Health Law Center have been working together to help healthcare organizations answer this call. Earlier this year, we released a Healthy Healthcare Toolkit, which is a suite of educational and technical tools designed to help healthcare organizations and other employers develop and implement healthy beverage policies. You can find more information on this project and the full toolkit on the Public Health Law Center's website. Today, we'll hear from hospitals and health systems that have committed to creating healthier food and beverage environments, and about the innovative partnerships that help facilitate these improvements. The presenters will discuss two state-level initiatives, the Colorado Healthy Hospital Compact and the Kansas Healthy Hospitals Initiative, as well as the implementation approaches taken by two health systems that stopped selling sugary drinks. Our first presenter will be Inka Duku, Nutrition Integration Specialist at the Colorado Department of Public Health. She will discuss the Colorado Healthy Hospital Compact, which is a voluntary program for hospitals to improve food and beverage options in cafeterias, vending machines, and patient menus. And she'll discuss how this framework can help health systems make changes in their food and beverage environments. Next, we'll hear from Tracy Shea, Workplace Wellbeing Strategist, and Kristen Millardo, Wellness and Ergonomics Specialist, both from Denver Health. They will discuss how their health system was able to use the Colorado Healthy Hospital Compact to help them implement changes within their hospitals. Haley Finch, Director of Education with the Kansas Hospital Association, will discuss the Healthy Kansas Hospitals Initiative. Healthy Kansas Hospitals provides resources on healthy workplaces, healthy bodies, and healthy minds for hospital employees and communities. And finally, we'll hear from Debbie Besson, Director of Clinical Nutrition at Holy Name Medical Center in Teaneck, New Jersey. Debbie will talk about the recent changes Holy Name has made to their beverage environment and how they use the closure of their food service establishments due to COVID-19 as an opportunity to accelerate these changes. So we've got a packed agenda today, so without further ado, I'm gonna hand it over to Inka to get us started. Inka?
Thank you so much for this opportunity to present and share with you all what the Colorado Healthy Hospital Compact is all about. As Chris has mentioned, my name is Inka Duku, and I have this opportunity to share with you all what Colorado is doing to support hospitals to improve their nutrition environment through the Colorado Healthy Hospital Compact. I'm going to refer to the Colorado Healthy Hospital Compact as the Compact. Next slide. During my presentation, I will provide a program overview of the Compact, focusing primarily on the Healthier Beverage Program, which is one of the four programs that make up the Compact, as well as our role as the State Health Department. What I'm most excited about is the presentation that you will hear right after mine, how the Compact is implemented at a hospital. My colleagues at Denver Health will share their long-term commitment to the Compact and how they were ultimately able to remove sugar-sweetened beverages from their hospital campus. Next slide. The Compact is a statewide initiative for hospitals throughout Colorado to improve their nutrition environment by increasing the availability of healthier foods and beverages and reducing or eliminating unhealthy items. The Compact is a voluntary agreement by hospitals that share a mission to protect and promote the health of hospital patients and their families, visitors, and staff by improving their nutrition environments. The Compact originated in 2014, where a few hospitals, local public health, the State Health Department, and a few community-based organizations came together to create the Compact. funding came from CDC from 2 of their grants over the years, which have supported the implementation and ongoing support to manage the compact through the Food Service Guidelines Worksite Setting Strategy. And in Colorado, we have selected hospitals as the worksite through the compact. To date, we've had 30 out of 100 hospitals participate in some sort of capacity. As I mentioned, the compact is made up of 4 programs, each including standards based on evidence-based or best practice. As hospitals implement standards, they earn points along the way that ultimately leads to levels of recognition. Next slide, please. So why hospitals? As key community institutions, previous slide, please. As key community institutions, hospitals are uniquely positioned to impact individual health behaviors. They are anchor institutions that can be leaders for the transformation of cultural norms around well-being by creating those health-promoting environments. We're seeing a nationwide movement. This exact webinar series has been highlighting hospitals across the country that have committed to creating healthier food and beverage environments for their employees, patients, and visitors. As mentioned earlier, you will hear from Denver Health how the compact has provided them with a framework and guide so they can commit and create a healthier environment. This picture was actually taken at Denver Health. Next slide, please. There are 4 programs that make up the compact: healthier food, healthier beverage, breastfeeding policy and support, and marketing. I plan to go into the most detail with this program to align with the messaging from this 4-part webinar series. Sugar-sweetened beverages are the largest source of added sugar in the US diet and a key risk factor for diet-related chronic diseases, which is why public health experts agree that the consumption of sugary drinks is one of the social norms that must be changed, and why not see this change in hospitals? And Denver Health will share their commitment to this and what processes they had to do to see this change happen. Next slide. So there's a lot of information on the slide, so I'll walk you through it. On the left is the nutrition criteria for the Healthier Beverage Program. It provides specific information on what counts as a healthy beverage. On the right is how hospitals are recognized. The more items they offer that meet the criteria and reduce or eliminate the beverages that don't, the hospital achieves more points. We encourage a tiered approach because we want to meet hospitals where they are at and support them as they increase healthier options and reduce unhealthy options. Next slide, please. So I want to share the benefits we have learned when hospitals participate in the compact. It provides a framework for hospital staff how to go about this work, and it provides structure for hospitals to begin this process. Participating in the compact is not an all or nothing process. Hospitals can decide which programs they want to choose and which standards they want to implement. They use the assessment tool to document their information, and the tool is how we determine their recognition. By participating in the compact, they are joining other hospitals that are doing similar work to improve their nutrition environments. They all use the same compact brand. They have access to a learning community of partners, and one way they can do this is by participating in a bi-monthly steering committee where best practices, lessons, and barriers are shared and ideas for implementation. Even though staff are representing different hospitals, it's an opportunity to collaborate together in the change process. And every hospital that participates receives public recognition. The recognition status is dependent on how many standards are implemented. The highest level of achievement is platinum, which only 3 hospitals have achieved this, and Denver Health being one of them. Next slide, please. Why is the State Health Department engaging, why is the State Health Department in Colorado engaging with hospitals around this work? We are able to do this with funding from CDC to provide overall program management, administer and facilitate the bi-monthly steering committee meetings with partner hospitals, and provide opportunities for hospitals. One example I want to share is that I've heard from hospitals that it's sometimes a struggle to get healthy products that meet the healthy snack standard. So I reached out to several vendors in Colorado, and they were willing to join a future steering committee meeting where as a group we can share with the vendors what the nutrition criteria is and how they can best work with each hospital to provide those snacks. This removes the burden from one hospital negotiating with snack vendors on their own. My role also provides ongoing technical support. I maintain and update compact documents and resources, including the assessment tool. I review all the assessment submissions and manage the recognition process. One way I was able to do this is host an event every other year where we formalize and recognize hospitals and their achievement. This picture was taken at our event in 2019 with our executive director, Jill Ryan of CDPHE, where she was there to present the awards. Next slide, please. So I just want to say thank you. I really wanted to have Denver Health really describe in detail more of the implementation of the compact, especially around sugar sweetened beverages. And so here's a picture of the Denver Health staff at the recognition event we had last year. And two of the people in this picture will present next, Tracy and Kristen. Thank you so much.
Great, thank you, Inka. My name is Tracy Shea. I'm the Wellbeing Strategist at Denver Health. I'm going to be presenting along with my colleague, Kristen Millardo, who oversees our ergonomics program and supports our Wellbeing Initiative. We're excited today to share Denver Health's journey that really led us to removing the sale of sugary sweetened beverages. Next slide, please. So before I tap into our journey, I wanted to share a little bit about Denver Health's journey. Denver Health has been part of the community of Denver for more than 150 years. Denver Health is Colorado's primary safety net institution, and we provide comprehensive and integrated care, emergency care to the public, regardless of ability to pay. We care for 33% of Denver's population annually, and Denver Health sees nearly 930,000 total patient visits annually. Denver Health provides care for 1 in 3 Denver area children each year as well as caring for the needs of special populations such as the poor, the uninsured. As a primary safety net institution, Denver Health has provided billions of dollars in uncompensated care and serves as a model for other safety net institutions. Next slide. So where does well-being fit into this? About 6 years ago, Denver Health intentionally set out to support the well-being of not only its employee population, but the community that we serve. One of our strategies to do this was to put more focus around our healthy beverage and food environment. So we were able to look to our partners with CDPHE and partner with the Colorado Healthy Hospital Compact. This really provided us with benchmarks and a framework and helped develop a very systematic strategy on what we could do over the next 4 to 6 years on how we can slowly improve our overall healthy beverage and food environment. We're excited that in 2019, we actually achieved platinum level status through the recognition with CDP and the Colorado Healthy Hospital Compact. Next slide. There's a lot of information on here, but we wanted to highlight that this wasn't something that overnight we really were methodically and slowly made small changes. In 2018 was, I would say, one of our larger policy changes where we did remove the sale of sugary sweetened beverages. We looked to increase healthy food options. And as I mentioned, we earned platinum level status with the Healthy Hospital Compact. This work started years ago. Back in 2014, we joined as a Compact founding partner with the Healthy Hospital Compact. We worked very strategically with our internal key stakeholders, which Kristen's gonna share in more detail about, to really develop a plan on how we could slowly start to promote healthy changes and add some healthier beverages into our cafes and around campus and in all of our Denver Health communities. We're continuing our work today. Denver Health is an anchor institution in the community, and really we see this work as not only impacting our employee population, but the community that we serve. Next slide. As I mentioned, this is a larger strategy, part of a community health improvement strategy that Denver Health is going into communities, into our places that we live and work to really support the overall health, and by improving the food and beverage environment is one small step to do that. Next slide. We couldn't do the work without highlighting some of our key partners. we're fortunate to have a public health department within Denver Health. So getting an executive sponsor and really leveraging the work that our public health team members were already doing in the community. As mentioned, working closely with the Colorado Department of Public Health and Environment, lean into the Healthy Beverage partnership, but also looking into other hospital partners, locally, Children's Hospital, as well as the University of California, San Francisco, leaning into some of the resources and best practices that already existed out there, really helped us to develop kind of our strategy and key steps to making these changes. Next slide. So I'm going to turn it over to Kristen Millardo. She's going to highlight our change management process, and then we're going to share with you all some of our communication strategies, barriers that we reached, feedback that we received from our employees, as well as next step. Kristen?
Thank you, Tracy. My name's Kristen Millardo, and I'm going to take it from here. So as Tracy highlighted, Denver Health has been working towards providing the healthiest environment possible for our patients, visitors, and staff for a long time. And so it was in 2018 that we really took that next step and launched our Healthy Beverage initiative. And really the goal of that initiative was to eliminate sugary sweetened beverages across the Denver Health campus. And so in order to do this, we were able to utilize Denver Health's internal lean department, as well as lean tools and lean methodologies, with the overall goal of improving our own performance, our own efficiency, and our effectiveness of the Healthier Beverage initiative. And so lean ultimately helped us prepare for and execute what we call a 2-day rapid improvement event. And this was the time where we planned out how we were going to tackle removing the sugary beverages at Denver Health. And so this type of work involved many things, but most notably it involved convening some key stakeholders, both internal and external, presenting and understanding some data that's going to help drive our decisions, and then creating action plans for our path forward. Next slide, please. And so one of the first priorities, one of the first things we did when utilizing this lean methodology was identifying our problem, right? And so for us, that was easy. The problem that we saw was sugar sweetened beverages being sold and being served at our hospital. We knew that Denver Health was caring for more than 17,000 obese and overweight children, as well as over 9,000 diabetics. We also knew that 1 in every 4 children in Denver was consuming more than 1 sugary drink per day. And so we knew that things like this increases the risk for things like type 2 diabetes, the risk for being overweight and obese, risk for developing fat deposits in the liver. And this was a real problem. We felt that we needed to really, walk our own talk. One of the other things that we were observing was that, sugary beverages were disproportionately impacting our patient population. Between 2012 and 2016, overall childhood obesity in Denver was remaining stable. However, obesity rates among the Latino population in children was increasing. And so all these things in concert kind of led us to identifying as this core problem that we were going to tackle through these lean tools. Next slide, please. So the next step in this lean methodology after identifying the problem is to identify the solution. And so a lot of lean tools and lean methods were used in doing that. And so we did things like identifying a clear goal and clear target state, which was really important. Identifying our key stakeholders and executive sponsor. Tracy mentioned that Denver Health is fortunate enough to have our own public health department here internally. And so we were able to leverage that partnership, and our executive sponsor was Dr. Bill Berman within the public health department. So really having that executive backing was really important and really critical to our success. During this time, we were also trying to understand our current state. So what does it look like now? Where is Denver Health at right now? And so things like the Colorado Healthy Hospital Compact Assessment Tool and data really helped accelerate our understanding of our current state. We also established action plans and communication plans, which we'll dig into a little bit more here as we go forward. And we also learned from industry-leading hospitals. We learned from Children's Colorado, who had eliminated sugary beverages before us. We learned from UCSF, like Tracy mentioned, and really kind of leaning on one another. People who have already done this work and who can already share things like best practices and unanticipated challenges was super valuable to us. And then one of the last components of this was, identifying our measures of success. So before any sugary drinks were ever removed, we identified, well, what will success look like? How will we know that we've achieved it? And what are some of the metrics that we're going to track now, along the way, and after the sugary beverages are gone? So to really simplify, we knew what our goal was. We knew we wanted to eliminate sugary beverages. Now we needed to use these lean tools and these lean methodologies to figure out how are we going to get there. Next slide, please. And so one of the most important pieces of going through this work was really identifying our scope. This was important because we needed to look at, where do sugar sweetened beverages live at Denver Health? Where are they sold? Where are they served? And really dig in and understand more about that. And so we used the Colorado Compact's definition of a sugar sweetened beverage. And so that really is any pre-sweetened drink with an added caloric sweetener. We knew and identified that these types of drinks were being sold and served in our cafeteria. They were in our catering and in our vending machines. They were being sold in our gift shop. They were also being sold at Subway, which was located, or still is located, in our main lobby, as well as on our patient menu. And so these were the areas that we identified sugar sweetened beverages, and these were part of our scope, and we decided that we were going to tackle these drinks in each of these locations. Next slide, please. And so I know I mentioned that 2-day rapid improvement event where we really used those lean tools, but I want to emphasize how much work went into planning and kind of doing our homework before that event. So in that event, that was really figuring out the how. We had all our stakeholders there and we were making plans, but there was so much work that had to be done before that. And so I really like to think about our pre-work process in 4 key buckets. Those are literature review, data collection, focus groups, and financial analysis. So we were doing this work for months and months leading up to that rapid improvement event. We read through the literature, leaned on other hospitals. We collected our own data internally. We used the compact assessment. We did some customer feedback and some customer observations. And then in these focus groups, we were able to leverage groups like our well-being champions and managers to really understand what are people's concerns, what are people's reactions to this type of thing, and really learn from them. And then the financial analysis, we all knew that finances was going to impact this conversation and impact this work in some way. And so in order to be ready to have those hard conversations with leaders, we collected a whole bunch of financial data, and we found that about 50% of all of our revenue from beverages was coming from sugary drinks. So we had to be ready to kind of have those hard conversations around, well, what happens when we lose that product that we were once making 50% of our revenue from. So we were tracking that financial data leading up to the change, and then have tracked it post that change and did so for about a year. Next slide, please.
I'm going to highlight some of our communications. And as I shared earlier, the timeline, our work started back in 2014. So over the years, we had been communicating to staff and to the patients and visitors of the hospital, signage to make the healthy choice the easy choice. But we knew we needed to do some targeted communications specifically around the removal of the sale of sugary sweetened beverages. So we spent months communicating this. So when the time came to actually remove all of the sugary sweetened beverages, it wasn't a surprise. At least we're hoping it wasn't a surprise to our employee population and to those that frequent in the hospital on a regular basis. So we shared a little bit about some of those risks and the why. Also knowing as our employee population, as healthcare professionals, many of those folks kind of understood those risks, but I think communicating those risks to our patients and visitors was also really important. We tapped into our internal communications, worked very closely with our marketing department. As Kristen said, we had our executive sponsor who did send out an organization-wide email communication about what our plan was and what we were doing and the why. Screensavers, all employee emails, newsletter content. For us, I think some of the most effective means of communication were those in-person tabling events and signage, and just being in those areas where we sold sugary sweetened beverages. So in our gift shop near Subway and in our hospital cafeteria. We also created huddle sheets for leaders and went to different leader meetings to really ensure that we were available. We also created a dedicated email account. So if employees wanted to reach out and provide some feedback, we had a direct way to receive that information. All of our communications were also translated into Spanish as well. Lastly, I want to mention with communications, a lot of it was around training those frontline staff that were working in those areas that we're going to need to provide information to customers when they were looking for a product that used to be there and were no longer there. So providing them with talking points and a place to point people with questions and provide that feedback. Next slide. This slide shows some examples of some of our communications that we created, again, internally with our communications team, is also leveraging some of the communications that our public health department was already using in the community. So I think tapping into some of the infographics and some really pretty visuals that we had around the hospital. So we created a lot of clings that were attached directly to the vending machines, banners that were posted right when you walked into the lobby of the hospital, table tents, etc. So the same messaging was out and available in all of our Denver Health locations. Next slide.
Yeah, so as Tracy mentioned, we had a whole host of different communication channels, and that really helped inform our next steps. And in order to do that, we had to lean on some of those measurements and metrics that we'd been tracking. And so I just want to kind of dig into that a little more and kind of show you some of the metrics that we are tracking. What you see here on the slide is a graph of our 2017 Subway drink sales data. And then you also see that that nice red line, which is the 2018 drink sales data. And so these were the types of things we were looking at. Again, things that were informing our communications, things that were informing our next steps. And like I mentioned, we continued to track this throughout 2018. Next slide, please. And so another metric that I want to call your attention to that we tracked were people's attitudes and people's perceptions about the change, both leading up to it and after it. And so this is just a sample survey question that we put out there. The question reads, in general, the majority of employees in your department had the following reactions to the healthy beverage change. And so as you can see, not everybody at Denver Health was super enthusiastic about it. You can see there that the response with the most was that they do not support the policy. Again, this data, these measurements and metrics just continue to inform our next steps and our path forward. Next slide, please. And one of the biggest things here that I kind of want to wrap up with is just talking about the feedback received. So it was really important to us to provide opportunities for people, employees, and visitors to provide feedback on the initiative. We knew that we were going to have to be able to answer some difficult questions and respond to some feedback that maybe did not show support for the initiative. And we wanted to ensure that people felt like they had a voice and had a place to share this feedback. Again, it really informed future decisions and future strategy. But with any type of change and any type of change management, providing this space for people to share their voice and to share their feedback is really important. So here on the slide, you can see on one side of the coin, on your left, people saying, you know, we're healthcare professionals. We have to walk the talk and should strive to eliminate unhealthy snacks, drinks, foods within the hospital. So we got a lot of comments like that. But on the right side of your screen, you know, on the other side of the coin, we got a lot of things that said, well, aren't diet sodas worse for you? This is inappropriate that we can still purchase candy or sweets, but, you know, I can't buy a regular soda. And so those were things that we just had to be prepared to answer. Next slide, please.
Yeah, and I think, thanks, Kristen. And I think that feedback also helped us determine what the future communications look like to help answer some of those questions. And I think for us organizationally, you know, knowing that we had executive support and ensuring that we had those managers, those key influencers to really help send the message that we weren't banning, you know, sugary sodas on campus. We just were no longer going to sell those, and we were no longer going to profit off of selling those. But if employees wanted to bring their own sodas, they certainly could do that. So for us, as we looked at, you know, what were lessons learned and next steps as we continue this work, as I mentioned, executive support and managers really embracing that change. We would encourage any hospital system or organization that's looking to make some of these changes to seek partnerships, whether that's in your local community or even internal partnerships in your organization, and not to work in a silo. Leveraging best practices and the resources that are out there that were highlighted at the beginning of this webinar, ensuring that you have clear goals and a target state so you know what you're trying to achieve. And then for us, I think we're still working on this one. How can we showcase some of the success stories? And by making pretty significant policy changes like this, hopefully we're impacting positively the health of our community employees. And we want to make sure we're continuing to look to see how we can highlight that. Great. Thank you all so much.
Thanks, Tracy and Kristen. It was a great presentation. It sounds like Denver Health is really committed to not only the health of their employees, but to the community at large. Now we're going to turn it over to Haley Finch to talk about the Healthy Kansas Hospitals through the Kansas Hospital Association.
Thank you, Kristen. Again, my name is Haley Finch-Genschork, and I'm with the Kansas Hospital Association. In my primary role, I oversee our education department, but I also oversee our Healthy Kansas Hospitals initiative. Health and wellness is truly a passion of mine, and I see it as medicine for the future. So let's go to the next slide, and I'll give you a little bit of an overview of Healthy Kansas Hospitals. The overarching goal of Healthy Kansas Hospitals is to help our members provide the healthiest environment possible for the employees and community. The Healthy Kansas Hospitals initiative is currently partially federally funded through the Kansas Department of Health and Environment Service Community Health System Flex Program. It's a mouthful. We actually work through our foundation of the Hospital Association, KHERF, as I'll refer to it as, and that they work through our state funding. And just a little bit about KHA. The Hospital Association was founded in 1910, and we currently have 122 community hospitals, with 84 of those being critical access hospitals. We are a very rural state. So next slide. Originally in 2013, Healthy Kansas Hospitals was a joint venture between the Hospitals Foundation, KHERF, and the Kansas Health Foundation, which is located out of Wichita, Kansas. 5 organizations were funded through the Health Foundation, all working to ensure that healthy options were the routine and an easy choice. Initially, the initiative was a 3-year grant with a 1-year optional extension, which we did end up taking. Next slide. Here's a high-level overview of the Healthy Kansas Hospitals initiative plan during the first 4 years. This equated to, this one PowerPoint slide looks so simple, but it equated to pages and pages and time of planning and efforts. But some of the initial things I want to highlight is, in the first year, we really wanted to define what was healthy. You know, healthy is so subjective. What's healthy for one person may not be healthy for another person. And so we wanted to establish that. In addition, the Hospital Association established a statewide advisory group composed of hospital leaders across the state, from big hospitals to small critical access hospitals. And then we launched this at our annual convention that year to really bring attention to it. In addition to Healthy Kansas Hospitals and the initial work we did as a hospital association, we also went out to our hospitals and asked them to sign a pledge to commit to Healthy Kansas Hospitals and exploring the opportunities around food and beverage and increasing healthy food and beverage. In addition to our hospitals signing that pledge, they also committed to getting resources and information and education about the initiative, and also the support of us coming out to their facility and being in their facility and interacting with their employees and community members. Next slide. So that sounds so easy that, we got hospitals to sign the pledge and then we got hospitals to implement policy, check, 1 year. Well, you can see that year 5 and beyond, we're still doing work. This started in 2013 and here we are, October of 2020, and we're still doing work. There was a lot of time and growth between hospitals' willingness to sign a pledge, which was a minimal commitment, no financial commitment, and they just had to give their word that they're willing to explore it, to the actual willingness of implementing formal policy change at their facility. And I use the word formal policy change. I'll use that in a minute again, but I do want to mention that we were looking for formal written policy change signed either by a CEO or the board chair of their hospital. So like I mentioned, this didn't happen overnight or even in a year. For some hospitals, this took years for them to come around to the idea of implementing formal policy change at their facility. I do want to note several hospitals through this time really got their wheels churning and started to make informal policy changes to their food and beverage during this time. However, we're hesitant to make it formal. A number of the reasons included what Colorado talked about and Denver Health talked about, which was the employee feedback or the worry of employee feedback. And they wanted to really spend the time floating this idea with their hospital individually. So with that said, in 2018, with our grant ending with the Kansas Health Foundation, the Kansas Hospital Association Board of Directors actually took this on as a strategic priority, and it was adopted into our strategic plan that following year for this to become a hospital association issue, which is amazing because that meant our work could continue and our hospital association was going to fund it when the funding ended from the grant. During the past couple of years, we have expanded our efforts to also include more than just food and beverage. KHA has added resources on education on hospital wellness programs, financial health, employee mental health, including burnout. In addition, we did revamp our tobacco-free initiative under the Healthy Kansas Hospitals initiative. So let's take a look at the next slide about how we supported our hospitals. I know this is really hard to read, and I'm going to walk through some of this and then we'll look at it more in detail. In the first couple of years when the initiative was getting off the ground, I did mention we did initial site visits at almost all 122 hospitals across the state of Kansas in person. This was asking them to really start looking at their policies and to sign the pledge, no commitment. To date, we have 81 hospitals out of 122 who have signed the pledge and 61 hospitals who have made formal policy change and submitted a policy to KHA. We'll explore more of this in the next couple of slides, but I do want to mention that formal policy change does not literally mean shaking up the hospital and doing a 100% approach. For some of our hospitals, this did work. They literally turned the lights off one night, turned them on the next day with a 100% approach of healthy for them. But for others, a softer, slower approach really worked for them. For us, we work at the hospital's speed and their direction. I'm just the resource from the hospital association to provide education and guidance and be there to listen to them as they're implementing policy change. Currently with our hospitals, we do several things to support them as they get their individual hospital initiative off the ground. Pre-COVID-19, man, has that changed my work with Healthy Kansas Hospitals, and we can talk a little bit more about that in a minute. But we would go out to the facility and have an hour and a half meeting with their hospital leaders, with board members, with employees to really bring them together to start looking at their policy. What I learned during these meetings is our hospitals are doing amazing work. They are doing a lot of work in a lot of areas, and that is where the challenge lied for them. Most of them didn't understand that doing a lot of work in a lot of areas really didn't create sustainable change. So it was met with hospitals becoming frustrated, employees becoming frustrated, and change not happening or reverting back to the original. And so that's where we really started looking at how can we support our hospitals better. And so we started creating these individual initiative plans. I call them the follow-up report. And that's what's on your screen. And this is a detailed report of everything we talk about, and then ideas and recommendations that I have for them in an order of completing. So it usually takes me about a week to write this report. I send it back to the facility, and then I give them about a 30-day period to go ahead and review it with their employees and those people that we met with. Hoping, fingers crossed, that in that time frame, they actually start looking at how they can implement policy change. So then at the 30-day mark, I pick up the phone and give them a phone call, and we talk about the challenges that they heard, the feedback they heard from employees about ideas they were floating. So then from there, they go back to their facility, and I usually wait about 90 days and contact them again, either in person or by phone. And we have another follow-up of how are they doing? What are they implementing? What's the roadblocks? What's the challenges? And you know, the feedback that we have received from this is having that third party that isn't emotionally involved in their hospital or emotionally invested in their hospital is a good sounding board for them. And so that 90-day period really does allow them to get their ducks in a row and to start implementing change. And then from there, it really is up to them to start implementing change. Usually for our hospitals, we see about a 6 to 9 month gap between the time I visit and the time they implement a policy, usually having to include a board meeting there to get some stuff signed off on their policies. So let's take a look at what my recommendations on those couple pages that you're seeing on your screen really are. Next slide, please. My 5 recommendations standard, usually for a hospital who has made minimal change, or they've made changes in a lot of areas and everybody's working in silos. These are the changes that I recommend, is creating a wellness committee. A wellness committee or a wellness advisory group can be composed of almost anyone. The standard people that may be popping in your head may not be the best people. You may want to have a negative Nancy on your committee. You may want to have a CFO who's telling you, well, from a financial aspect, this doesn't work, and those challenges. So I usually say, depending on the size of the hospitals, depending on how big or large or small your committee should be, or if you should have subcommittees, all dependent on the hospital. And the second is to review your current policies. I don't know how many times I've gone out to a facility and we sit around the table and I bring up a policy and somebody randomly says, oh yeah, we have a policy on that. Half the room doesn't even know. So bringing all those wellness policies to the table and really looking at what you have in front of you, what's old, what's outdated. Some hospitals don't even have vending machines anymore. Probably shouldn't have a policy if you don't have one. And then also looking at those informal policies or traditions is what I like to refer to them as. Donut Friday, something you're probably not going to break, but could you revamp? I have to tell a side story is I was at a facility and they were no way going to get rid of their Sunday bar employee appreciation event. They've had it for 100 years, never going to get rid of it. And so we started talking about how can you creatively change it? You know, and so they had the year before changed it to a yogurt bar, and it didn't go over well. Obviously, they did not communicate it, and it didn't go over well. So instead, we started talking about what could you change about it? Could you change the size, the portion controls of it? And, you know, just looking at some of those things when you're looking at traditions and formal policies. Side note, I do think that policy should be reviewed every year, even if your ongoing successful implementation of your initiative. Every year, a policy should be reviewed at least. And in the initial phases, you probably should be looking at it more often than that. Number 3 is really encouraging those easy wins or low-hanging fruit. We'll look at more of those in the next couple of slides of some of the successes our hospitals have had in doing that. But I do really believe when you're hitting roadblocks with your employees about buy-in is having some of those easy wins that they don't see as huge changes can really go over well with them. And Colorado mentioned this. I cannot agree more. Communication is key. There is nothing worse than an employee walking into a facility and seeing a change before they were ever communicated that change. That will create employee revolt instantly. So over-communicate the change and over-communicate the why. And then finally, I think this is a given, but having that leadership support is so important. Having leadership buy-in and leadership showing the changes are being supported is amazing and can go a long way. So next slide. So I won't read this list to you, but this is a standard list that we give our facilities to start helping them understand what kind of policies are we talking about specifically around food and beverage. What are some marketing strategies that you can use to help initiate these changes and incentivize your employees? Again, this is a really learning point for me, was going to a facility. Our hospitals in Kansas, like many of your hospitals across the United States, are in financial distress, and they don't have the budgets to wipe out a vending machine or take out a fryer. And I learned from a hospital CEO, he challenged me. He said, I want to participate in Healthy Kansas Hospitals. I'm a health guy, is what he said. And he said, but I can't take out a fryer that costs me XYZ number to replace it with somebody else that's going to also cost me money. And so we came up with a strategy, a creative strategy, that when it breaks, don't replace. You replace it with a healthier option, or you don't replace it at all. And, you know, honestly, taking a step back and looking at other areas, we started looking at the vending machine. Don't wipe it out. When an item sells out, you no longer need 5 categories of M&Ms. You can have 1. I also challenged him that before making any decisions, you should be making educated decisions and not educated guesses. Educated guesses lead to employee disruption. Educated decisions lead to you being able to have a why to then explain back to employees. For example, I was at a facility and they were looking at their vending machine of reworking it, and they never had honey buns. And so they thought, well, we don't sell any. So I challenged them to pull the selling report on how many of each product they sold and what they could remove to have healthier options versus not healthier options. They sold 1,000 honey buns in this facility a year. It was the #1 selling item. As much as I wanted this hospital to remove that, that was not the best decision for them to start with. And so therefore, they didn't. They started with some other options and have worked towards a fully healthy vending machine. So speaking of vending machines, on the next slide. All right, thank you. This is a picture of a vending machine in Atchison, Kansas. And again, this hospital didn't have the budget the first year to make real changes and to make changes that were in a monetary value, but they did have the ability to think creatively. And that is what I challenge most people to think about food and wellness. They had the ability to move product around in their vending machine. They had the ability to talk to their contract company who was doing their vending machine and seeing if they could add healthy options. And then they got real creative and said, we have stickers. Let's mark our vending machine of healthy options with red, green, and yellow. None of these things that they did to their vending machine to start revamping it cost any money. And so with them, what they learned is that they had a ton of red options and they had minimal green options. And so over the years, this is an original picture, but over the years, they have worked to add in more green options and less red options, working through the stoplight system. Also, they noticed that vending machines, this is again a side note, vending machines offer larger portion sizes, and their vending machine contract service company actually offered a smaller portion size, which would tend to lead things into that yellow or green size instead of a red portion size. So I ask you to think creatively again about this. Also, vending machines currently on trend are becoming the food service for most hospitals more than their cafeterias because it's open 24/7. So I always challenge our hospitals to look at the vending machine and ask, can you make a meal out of it? At midnight, when your mom's in the emergency room and you're hungry and this is the only food they're getting, what can you do to make it a healthy option? And the #1 thing that I have seen that is lacking in vending machines is protein. Healthy protein that's not covered in chocolate or salted completely. And so that is one thing I do challenge our hospitals, is to start looking at how to add healthy proteins into their vending machines. Next slide. So like I mentioned, we did we added to our initiative in 2018. We added in other areas of wellness to include mental wellness and physical wellness, and expanding our website to include these as resources as well. So I want to highlight on the next couple of slides initiatives that we are taking on. This actually was in perfect timing. Right before COVID, we adopted a partnership with a Healthcare Associates Credit Union. This Healthcare Associates Credit Union is based out of Illinois, and they partner with hospital associations at zero cost to offer a multitude of finance-related resources, including free education, get out of debt education, financial counseling, budgeting, retiring. They actually have done several free webinars for the hospital associations for all of our members to educate this past spring on psychology of spending, budgeting, personal budgeting. And during non-COVID times, they actually come out to facilities and do education at all hours of the day, which is key. I don't know many other education resources that will actually do a midnight shift education with food to that specific staff and it not be pre-recorded. So I know that people are probably asking, and if Craig was on this webinar, he'd be like, why is she talking about financial wellness? Well, especially with the pandemic, this is going to be a major stressor going forward for our people and for our employees and for our communities. Finances affect people's physical and mental health. It's a full circle. I don't know how many employees right now we have that their significant others on furlough. It's causing stresses. It's causing people to eat more off the dollar menu and less healthy options. So if there is a resource out there for you to support financial wellness, it's becoming one of my new passions in helping people feel better. Next slide. One of the other things that I just thought was so creative and cost $0 that one of our hospitals was doing is looking at their 15-minute break policy. So most people know that 15-minute breaks are used for smokers. The smokers go out and use it. And this hospital CEO wanted to make it known to employees that they could use it for alternative reasons. And that if you aren't a smoker, you get to use your policy, you get to use that break too. So they created a walking policy that you could use it to walk around the building or walk around the parking lot or outside and get up and get moving. And honestly, this was so highly encouraged by the CEO and received by employees and it wasn't rocket science, it's free. So I encourage you to look at some of those policies that have gotten some stigma around them or some norms around them and revamp them. So I know I'm running short on time. I'm going to go through the next several slides quickly. The next slide is an abundance of resources that Healthy Kansas Hospitals has created, including sample policies, sample catering guidelines. We have 9 white papers on hospitals that have won our award that I'll talk about. And then finally, we have 3 toolkits that have all different kinds of resources, including some of them being written in partnership with the Public Health Law Center. Again, I'm happy to share these resources with anybody on the call today. Next slide. Quickly, I just want to share some of our success in Kansas. I mentioned on the next slide, there's 81 hospitals who have signed the pledge and 61 hospitals who have made formal policy change. Oh, next slide. Thank you. Here are the 61 hospitals who have made formal policy change. We take any opportunity to highlight them and to show their success. This has been one of the great successes in Kansas is Healthy Kansas Hospitals is a non-compete initiative. You're not competing with another hospital. So it's an easy way for our hospitals to pair and share and to really help each other create success. And with that success, on the next slide, we've created the Healthy Kansas Hospital Centers of Excellence Award. This award is given out annually, and the only criteria is that you've had to make formal policy change submitted to the Kansas Hospital Association. We come out to the facilities and do a award presentation, and we give them $1,000 to use towards their wellness initiatives. Next slide. And again, here are just our award winners over the past 5 years. Actually, tomorrow we're getting ready to go out to Smith Center and do their award presentation. And so we are excited to do that as well. So next slide. Here's my contact information. If you have any questions or want to follow up on any of the resources I shared, I'm happy to do so. Thank you.
Thank you so much, Haley. Just before we move on to hear about the changes at Holy Name Medical Center, there was one question that came in about the financial resource that you talked about. Can you just repeat the name of that organization?
Yes, it's the Healthcare Associates Credit Union, and they partner with hospital associations and individual hospitals.
Great. Okay, thanks so much, Haley. And now we're going to hear from Debbie from Holy Name Medical Center in New Jersey and hear about the changes that they've recently made and how they used the COVID pandemic as an opportunity to accelerate some of these changes. Debbie?
Hi all. I'm Debbie Besson, Director of Clinical Nutrition at Holy Name Medical Center, and I'm happy to share our journey to our sugar beverage policy. As you're going to see, it's quite unconventional. Next slide. We're a private community hospital, not associated with any other organization or hospital network, which is actually very rare, especially around here these days. In fact, we are one of the few independent hospitals and New Jersey's only independent Catholic hospital. Holy Name actually just celebrated its 95th birthday. Sodexo manages our food service. We utilize their Mindful program, and about 5 years ago, we got rid of fryers and ramped up the salad bar selections. More recently, we added healthful entrees centered around the Mediterranean diet, and we did this because we actually did a study on our employees. We put that were pre-diabetic. We put them on in three different groups: a Mediterranean diet, a intermittent fasting, 8-hour, 16-hour, and a low-calorie fast diet. Employees on the Mediterranean diet lost the most weight and had the largest reductions in hemoglobin A1C, so we really highlighted the Mediterranean diet in our cafeteria. Now, I do acknowledge the fact that we are a smaller private hospital and already started with this healthy mind, so it did make it easier for us to accomplish the changes in sugary beverage very, very quickly. Next slide, please. In December of 2019, we had some organizational changes in our department. I was promoted to Director of Clinical Nutrition from an oncology dietitian, and we were separated from food and nutrition. Now I report to an administrator nurse who reached out to me after learning of the Public Health Center's Sugary Lab Learning Lab. We both jumped on it. We were excited to have support and a group we can consult with. We learned a great deal from other hospitals, and we were making plans to put in places steps to our goal of removing sugary beverages from our food services. We were especially interested in product placement, pricing, and of course, education. Next slide, please. What we heard from Sodexo was their concerns regarding customer satisfaction and revenue. When the report for the revenue of sodas came out, we all were a bit shocked. But with administrative support, we carried on. Throughout this process, our mantra was always, we're doing this because it's the right thing to do. Next slide, please. National Nutrition Month was a great way to start the education and present alternatives to sugary beverages. We planned on weekly events, the first one focusing on sugar in beverages. Next slide, please. We showcased the teaspoons of sugar in each beverage, which is a great visual. Next slide, please. One more. And we had a tasting of the no added sugar beverages that we were planning to use. We were preparing for our next week's National Nutrition Month display when March 11th came along and COVID-19 was declared a pandemic. Next slide, please. So all of a sudden, overnight, all focus was changed. We closed our visitors' cafeteria and changed our employee cafeteria to all foods individually wrapped, no salad bar, no soup bar, and the hospital provided all meals at no charge, breakfast, lunch, and dinner, to employees. They even encouraged employees to take food home for their families. At the same time, restaurants, organizations, and companies were donating all types of food to our staff. Lunchtime became an event to see what goodies the cafeteria had. Next slide, please. We got comfort food, and we got lots more comfort food. Next slide, please. Many, many treats from all different areas. We even, Mars company even sent us personalized packets of M&Ms because one of our respiratory therapists told a reporter that M&Ms was her favorite feel-good food. The next week, they sent us cases. I did manage to advocate for some healthier meals and snacks. There was a local company called Dr. Pickle, who donated 200 containers of fermented pickles. At that time, he was unable to sell them at farmers markets, so he brought them over, and that was a huge hit. Next slide. Here are some healthy snacks that were located in our brand new Zen Den that we had for employees for relaxation, de-stressing. We had 2 massage chairs in a dark room with soft sounds and lights. One more, please. The Zen Den also had immune boosting juices that we made for staff, which was another big hit. So Staff was definitely enjoying and appreciating the healthful stuff as well. Next slide, please. In May, staff started to complain to the group of dietitians of weight gain, which was as expected with all the food. We realized we had to make a change. They were getting tired of the heavy food and sweets, and at the same time, we were also hearing about local food pantries drying up and needing support. So we launched a 2-week Sugar Buster program fundraiser. For $20, employees received a 2-week meal plan with recipes, a shopping list, and daily motivational and educational emails relating to sugar, especially sugar, excess sugar, fiber, exercise, hydration, and mindful eating, and more. We also provided some of the meals in the cafeteria. We had 175 employees sign up. We raised $3,500 and were able to give to 2 different food pantries in the area. Next slide, please. After the fundraiser is when the push to reopen the cafeteria took place. We wanted to go back to normal-ish. So reopen the cafeteria was going to be a big deal for a couple of reasons. The CEO and administrative staff were actually heavily involved, which ended up being to our benefit. Dealing with COVID, they wanted to make it contactless, so they created an app so employees could order first and pick up later. Everything was to be individually wrapped and with the least contact. The team decided now was the time to remove all sugary beverages and artificially sweetened beverages. The focus was to be on the quality of the ingredients and meals and not on the disappearance of the soda. We created grain bowls, vegetable-filled sandwiches, and really good hefty salads. I worked with food service operation manager to find the best substitutions for beverages, and we actually found a lot more than I hoped. Next slide, please. This is our new soda case, or non-soda case. All of these beverages have 0 added sugar and no artificial sweetener. We have another case of 100% juices and unsweetened milks and plant milks. To the right of these cases was a soda machine that we dismantled and returned. Next slide, please. Our sugary beverage policy is waiting for signatures from administration, but here are two statements. The policy also states that anyone can bring in sugary beverages to the hospital. There is no ban on drinking them, just a ban on the hospital selling them. Next slide, please. We also changed our patient menus. Oh, next slide, please. Thank you. We also changed our patient menus. We took off all soda and other sugary beverages like sweetened iced tea off the menu. Our policy states that a patient may have sugary beverages upon request and ordered by a clinician, any clinician. So it's not on the menu, but if a patient requests it, they can get it. In the beginning of the cafeteria changes, there weren't too many comments because everything was brand new. New food, different beverages, and I also believe that the employees thought that the soda was coming back but was just delayed for some reason. A few months later, as predicted, we started to get negative feedback, specifically about the artificially sweetened beverages. Many of the doctors complained to the point where an administrative doctor reached out to me. He pointed out that no good studies supported the ban of artificial sweeteners. I was open to leaving a few diet alternatives in the soda case, but the team as a whole decided not to do that. I did find some interesting animal studies showing weight gain and microbiome disruptions with artificial sweeteners and put them in the policy. The other popular statement was, why are you allowing desserts but no soda? And this is where participating in the sugary beverage lab really helped. This had been addressed beautifully. Beverages are a daily habit, constant and throughout the day. Most people will have desserts as a special treat, not daily. Next slide, please. This concludes our recent experience with sugary beverages in our hospital organization. I'm certain that these are not the only changes we will be making. We're also starting to look at sugar content in patient tube feeding formulas and its effect on the health of our patients. I hope this experience was helpful. It was dramatic for sure, but I hope it was helpful. Thank you.
Great, thank you, Debbie, and thanks to all of our presenters today. Just a note on ways to contact for more information at the Public Health Law Center are on this slide. And we've got a few questions to get through, so let me just jump in. One person asked they're interested to hear what you do to promote drinking water. I know a number of you talked about making sure water was available, but does anyone have any experience with actually kind of promoting those healthy alternatives, including water?
Kristen, this is Tracy Shea. I can jump in. I think that question came in when we were presenting. A couple things come to mind. I think, you know, living in Colorado, I feel like everyone out here carries a water bottle wherever they go. So out here, maybe I feel like just living at altitude, people kind of know the importance of drinking water, but I feel like it's also more important than ever. Just it's very easy to become dehydrated. But I think we try to incorporate having water available at all employee appreciation events. We partnered with Denver Water, and they actually brought a water truck out to a big employee barbecue that we have. Our cafe also provides infused water, like spa water. And so we did a lot of kind of tabling events and had recipes available to be able to encourage people, if they don't like just plain water, how you can jazz it up a little bit to ensure that you're hydrated. The majority of our water fountains across our campus all have the water bottle filling station, and we did some water bottle giveaways as different wellness initiatives as well. So
great. Anyone else want to talk about water promotion? Any?
Yeah, and that's one of the requirements with the Colorado Healthy Hospital Compact, is to provide free water.
Mm-hmm.
To encourage that water consumption. And I've seen it in all different ways, where one of our other hospitals that have removed sugar sweetened beverages, Lutheran Medical Center, has this huge display when you walk right into the, and that could look actually different now, but prior to COVID, this huge glass water thing with infused fruit. And so every day would be a different fruit. And so the employees would be excited. Is it strawberries today? Is it lemon today? So just sort of making it a very visible, pretty thing as well.
Yeah. Great, thank you. Okay, another question. We hear from our food service directors that a barrier is long-standing contracts with companies like Pepsi, et cetera, that have requirements to purchase less healthy beverages. Has anyone encountered that barrier, and how did you overcome it?
Absolutely. Here in Kansas, yes. And I did not realize how long-standing means when it comes to vending contracts, 10, 25 years. And these contracts were signed in the 80s. And so couple aspects is, one, pull that actual contract out and see what it really does say. Don't rely on the vending company to tell you. A lot of our hospitals, I've realized, don't have the contract in front of them. It's so long-standing. And so then from there, if you do have a long-standing contract that you can't get out of, is start having negotiations. So it's not so much of getting rid of the contract, but what can we do? I mentioned several of our hospitals have 5 different types of M&Ms. Can you negotiate one of those out for a healthier option and start looking at that? I know that Coca-Cola, Pepsi, they have a monopoly on vending machines. This is a passion of mine, because I definitely think it's one of those areas that we truly could have a lot of effect on, but because of that barrier, that roadblock, we don't. So I just say, take it one step at a time, find the contract, look at it, and then start looking at one item at a time to negotiate out.
Right. I was curious to hear from Tracy and Kristen on how you dealt with the
Kristen,
franchise restaurant Subway.
Kristen, can I say a follow-up to vending machines real quick? One of the things I didn't highlight in our initiative is we've actually started seeing hospitals put in airport style vending machines, which will have like open coolers. It's self-pay. It's not like where it's just like a glass, but they actually have open coolers that you can see, more airport styles. And we have a really great resource here in Kansas of a company that actually does them. Blanking on the name right now, but it is innovative, it's new, and one of the greatest things about it is it's zero waste. So they bring the products in, they refurbish it, or they restock it. And so if you don't have a current contract and that's something you want to look into, it's a great alternative to this stereotypical vending machine.
Right, great. So yeah, I was asking Tracy and Kristen about how you manage the contract with Subway. We've heard from a number of hospitals that those types of franchise restaurants on site can be difficult. And did you get Subway to actually agree to the policy, or did you have to kind of work around that in some way?
I'll take that, Kristen, chime in. So I would say that one was a little bit easier for us because that contract was a subcontract to Sodexo, who is our food service vendor. So because we were making kind of that policy change within the hospital, and Sodexo was being asked to make that change, we were able to then ensure that they were making that change. We did at the time, we don't anymore, we had a Potbelly that was a separate like retail agreement, and through that contract we weren't able to require them to make the beverage change. But the way that the Subway was set up and the contract was laid out initially. I would like to highlight though, I think with Subway, one of the challenges with that is people, when they go into a Subway, they kind of expect the same menu wherever they go. And the beverages are usually at the end of the line. You know, you go to the fountain style to get your beverage. And so even though we had signs all up that said only diet or no sugary beverages, people would purchase kind of the Subway package meal and then go to the fountain drink machine, and then their soda wasn't available. So we had to do a lot of kind of education and communication with that group. Kristen,
Yeah,
anything
and
to
then
add?
just to add on to that, working with our vendors for drinks in the vending machine, as well as working with Subway, I felt like we had, I don't want to say some power, but our vendor canteen had worked in schools, had worked in other hospitals in the area, and those organizations were really trying to do the same thing. And so by the time that we were starting to roll this initiative out in 2018, it wasn't really new to them, and they had seen this pop up with their other clients. So I think kind of that collective power between organizations in the area, in the region, who are all trying to do the same thing, is really strong and really powerful when getting people like Pepsi and Subway on board.
Yeah, that's a great point. Okay, another question. When you focus on serving healthier foods to patients, employees, and guests, was there also a focus on making that food great tasting? And if so, has anyone been able to link employee satisfaction scores or patient satisfaction scores with their changed menus? Anyone?
I will say this is a hesitation in Kansas of why most of our hospitals have focused strictly on employees and tested it out almost on employees because of that patient satisfaction score, and just they're not willing to risk that quite yet.
Right. Yeah. Okay. We had a couple questions come in through the registration site. So a number of you alluded to employee feedback. So somebody asked, what are some of the strategies, the marketing strategies that you used when you had your leadership on board, but it was really the employees who were wanting the unhealthier options, and especially during these stressful times when people are looking for kind of comfort foods and things to alleviate stress. Any tips or experiences with dealing with that? I know a number of you mentioned getting kind of negative feedback from staff. Were you able to respond to that feedback, or just kind of note it and move on?
I can offer a couple thoughts and ideas around that. So early in our conversations around this, some of the ideas that bubbled up with leadership through our lean events were kind of equating sugary beverages to like smoking or serving alcohol. So it's like, well, we don't do that here either. And so in the same vein as trying to only provide things to our patients that are going to provide health and healing and nutritional benefits, you know, we don't serve those things here either. So that was like one type of conversation. And then another type of conversation that we had that really kind of shined through in the marketing was showing that we're proud of this, that we believe our role as an anchor institution and our role as a healthcare institution it really is to be proud of this change and really try to embrace it. So that was something that really came through in our marketing and in our images that we showed in our slide deck too. So really trying to kind of get people, you know, we're all on the same team, we're trying to do the right thing and we're proud of it.
Yeah. Debbie, were you gonna weigh in here as well?
Yeah, I could just add that the same thing, the pride and walking the walk was something that we kept saying too. You know, we got to walk the walk. We are a healthcare institution, and a lot of, I want to say a lot of doctors really complained a lot more than employees, more than other staff, and it was I feel like they felt like we were taking away some rights, and we said that we had nothing to do with what you're doing. Outside, we're just don't want to supply it to you. That's all it was.
Yeah. Great. Okay, another topic that came up quite a bit was kind of alluding to revenue and the impact that these changes might have on revenue. And Kristen, I know you showed a slide that showed a pretty substantial drop in revenue within the Subway establishment. Have you guys tracked revenue longer term and seen any changes, any bounce back of revenue, or has it stayed kind of more depressed from those changes?
Yeah, so we tracked our beverage sales across every entity that served beverages. So that included the cafeteria at Denver Health, you know, the Subway vending, and then even our gift shop. And we learned from Children's and from UCSF, like, yep, be prepared, there's gonna be a dip. So we were ready for that, and it wasn't really a surprise. We tracked those metrics for about a year, and we saw them rise slightly, but they never outpaced the previous year's performance. And so for those reasons, there became a point where it wasn't really informing any next steps. So we stopped tracking that long term, but there's a lot of other confounding variables that also led us to stop collecting that data. So at the exact same month that we rolled out the Healthier Beverage Initiative and limited sugary beverages, we had over 1,000, I believe, Tracy can chime in if I'm incorrect, close to 1,000 employees move over into a new admin building. And a lot of those employees were no longer going to the cafeteria or the Subway or the gift shop to purchase beverages just due to the physical distance. So that was kind of confounding. We couldn't really say, well, was this directly due to eliminating sugary beverages, or were there some other variables at play here? Right. And then additionally, the whole idea of promoting water, like Tracy mentioned, we're hoping that people aren't buying drinks in many ways, right? We're hoping they're drinking water because that was really part of our messaging. And so again, just these confounding variables, it's really hard to say what the true determinant independent variable was. But yeah, we never saw those beverage sales return to pre-sugary beverage elimination places.
And Debbie, at Holy Name, you put on your slide a pretty astounding number as far as the revenue that you were seeing from sugary drinks. Have you been able to track how that number, I know your change has been just recently implemented, but
I do plan on getting that information. And again, is it going to be helpful? I don't know. Sometimes you don't really want to know these things, but it was, we were all shocked at that number, including the food service director.
Right. Okay. One other question, are any of these changes in policies looking at buying and offering more sustainable foods? I know a number of healthcare systems are looking at kind of sustainable purchasing. And this might be a question for the state level organizations that are supporting some of these hospitals. Do you see that issue coming up?
Yes, I actually have been embarking and working with 2 organizations that are looking to increase sustainability around beans and wheat in Colorado, or high protein wheat options or quinoa, things like that. And so again, trying to really think about the local food system in Colorado and pairing farmers to institutions like hospitals, but also needing that middle person to create the product. And so there's 2 USDA grants that Colorado was awarded, one through the University of Colorado Springs, Colorado, and the other one through an organization called Healthcare Without Harm, which is a national organization, but Colorado is one of the participating states. So it's really exciting because it's sort of like pairing that farmer to a producer that can make the product to the institution and ensuring that, and then that education piece as well.
Right.
So there is a lot happening in Colorado around sustainability and food access.
And do you hear interest from your hospital partners in this, taking this on?
Yeah, more and more so our hospital partners are wanting to purchase local. Of course, there's the barriers to procurement and contracts that have been held with national companies for a long time. And so there's something called the 20/80 rule oftentimes where only 20% of the procurement can be local. And so it's sort of trying to figure out innovative ways to support local economy, because sometimes that national food system, it is cheaper. It is cheaper to buy from a national food system rather than a local system. But it's because of COVID, it has really shed light on the impact that COVID had on our farmers and in agriculture. And so a lot of conversations are happening around that, especially with our city and county of Denver are embarking on the Good Food Purchasing Program, and some of our local hospitals are participating in that process.
Great.
And I had to piggyback off that. Being so close to Colorado, we have some very similar challenges, even though we're very different states. Our communities are having the same thing. We actually have a hospital out in Hayes that has partnered up with a local beef because it was so much cheaper to buy local, and they've started that. But like Colorado, that middleman having somebody process it and making sure there's a connection is just, it's a challenge. Being out in food deserts have actually, and a food desert is definition different in each state, but in Kansas, we have several pockets of them, and they've started doing their own gardens to do it themselves, to cut out the middleman, to cut out. However, there are some challenges and some rules and regulations around patient interaction with that and patient eating those, but they've used that a lot for employees to offset some cost and to get education around it. Some of our there's a hospital in north central Kansas that uses it as their long-term care, actually sustains it. And so they actually use patients to help as a hobby. And so it's just, there's some interesting small stories around it, but nothing that's gotten off the ground at a large statewide effort. But to answer your question, Kristen, there is absolutely interest in it.
Right, great. And then one more question. Does anyone have any tips for hospitals that are located in retail areas where their customers, employees, visitors can just go next door and grab a burger and fries at a restaurant that's off campus? And how might you kind of prevent the loss of that customer from the hospital facility?
Kristen, I can take that one. I think where Denver Health is kind of in a very urban downtown area. Across the street, there are tons of restaurants, probably closer than walking across the street to the main hospital. In addition, we have 10 outlying clinics in the underserved areas of Denver. So not even kind of our main campus, but outlying facilities. I think at our main campus, one of the things that our cafe has done that's worked well is they have actually created like a little pop-up like sandwich shop where they've brought prepared meals, hot meals to our administration building and set up in one of the break rooms. And they're very busy. So just trying to eliminate that barrier of having people kind of walk across. It's also less expensive than going to the sandwich shop and spending a lot more on a sandwich and a soda, where you can buy some of those items. So that has seemed to help. And they just started that actually since COVID hit and some of the restaurants were closed, but I think they're going to continue that. So.
Great.
Kristen, from even not in an urban area, a lot of our small critical access hospitals fight the dollar menu. And we hear it again that they can eat cheaper off campus than they can on campus, and they don't want to invest $7 in a healthy option that they've never heard of or they may have questions about. And so we actually suggest a marketing tool of like a taste test Tuesday where you implement something, like black bean brownies. You let people taste it before they ever have to invest their money in it. people aren't willing to do it. So, and then also just offering it at, offering the healthier option at a reduced cost. But I think that all areas face this, not just urban.
Yeah.
One of the things with the Healthy Hospital Compact is one of the programs is marketing, and there's several, up to 20 different ideas that hospitals can do to sort of market the healthier items, whether it be pricing, promotion, placement of items, awareness, information, like you had mentioned, Haley, in your presentation, the stoplight system. And so all of these taste tests before someone can buy it, also pricing, price promotion, I think I mentioned that already, pricing the unhealthy items higher and the healthy items lower. And one hospital that participate, they give the food at cost to all employees. So they don't even make a profit off of the food. That's how they're really able to allow employees. I actually ate there early January, and it was, low cost. I was like, wow, this is the price for a sandwich, and it was delicious. And so just really thinking about the employees.
Great. And finally, just one more question for Debbie, since we have a couple minutes. Someone is interested in hearing a little bit more about the research study that you mentioned at the end of your presentation, looking at sugar content in formula feeding patient health.
Oh yeah, this actually all stemmed because of COVID. We have this, I want to say a organization that will remain nameless because they want to be nameless, that has been helping us, a non-healthcare organization that has been helping us, our hospital, with COVID-related things. And one of them was I think that a family member perhaps was spun into diabetes because of, they thought anyway, because of a COVID stay, and was given 2 feedings that had a lot of sugar. So that that's kind of what prompted this. And I'm all over it because I don't really support the common conventional 2 feeding formulas. For short periods of time, it's probably fine, but really not for long periods of time. So we started investigating, and we did find an organization, a company called Liquid Hope. I don't know if you guys know, but they're a real food blend 2 feeding formula. So we're going to start our study in about a month or so. We just passed IRB, and we're going to be studying about 200 patients, 100 on the formula, 50 diabetic, 50 non-diabetic, another 100 on conventional formula, 50 diabetic, non-diabetic, and we're hoping to see a difference. Now, the biggest challenge is going to be finances, just like everything else. We have contracts too, just like with vending, we have 2 feeding contracts, and so we'd have to prove that this is going to be helpful to our patients in a big way, because the price difference is pretty big.
Okay, I think we've gotten through all the questions that I'm seeing. And I just want to thank everyone. We are right at time, so it's perfect timing. These presentations were all fabulous, and it was so great to hear so many different perspectives coming at this issue in different ways. So thank you, everyone, and thanks for joining us. And we have one more webinar coming up sometime in November that we will be communicating with everyone about. Have a great day.